Hospice. It's a word that doesn't come up in our conversations very often. The word has been in our language for less than a century. When someone talks about hospice, it's full of misunderstanding and even fear or apprehension. When people hear about hospice, they think about death, but the focus is really about life, about quality of life. What does hospice mean exactly? Hospice is a service, really. It takes into account the whole person, who they are, what's important to them, and their family. It's a support system for them. Sometimes it's utilized at the end of life, but not always. Generally today, hospice care takes place in the home, sometimes in a nursing home or an assisted living community. Every situation is unique.
Through hospice and through your experience with hospice, it takes some of that fear of the future out. And I think also helps people when you're dealing with the reality of death and the immediacy of death, as it was hundreds of years ago when families were together, celebrated birth, celebrated death because we knew it wasn't the end. We take some of the fear out and it becomes a loving, wonderful, sweet thing and part of our journey together. And families can remember back and remember that it was a gift. Mom, dad didn't die, in the hospital. Mom or dad, died at home, and we were all there, and we were able to be there, and they were able to be present for us until shortly before the end. That's a wonderful gift.
We found that allowing the patient to stay at home is best, not just for themselves, but also the family. Everyone is in a familiar surrounding. Part of our service is to get you the help you need. We educate the family on how to provide care in the home, what to expect, what the process will be like.
It's very important to involve the whole family unit. For some people, families are quite small and intimate, and for others, families are quite large. And there's so many people with different roles in the family, but usually every family's role is very, very important to the patient, whether it be even a neighbor or not family, really, their friends. Anyone who's important to them is important to us.
Hospice is not for medical cures, but it may provide pain management, emotional and spiritual support, and caring for the family, how to treat their loved one, how to help them.
Well, I'm a nurse here. My primary duty for patients is to take care of them, whatever that care entails, whether it be their physical pain, their emotional pain. I put all the people in the right places to help them be comfortable in all areas of their life. So usually I'm the first face that they see in their home, and I'm finding out what's hurting them, whether it might be an organ or they're sad or whatever it is, and then I call in all the other people who might be needed and things to make that go away. So it could be medications, it could be oxygen, it might be a chaplain or a social worker, it could just be a friend. All those people in one place to help that patient have that comfort for their end of life.
A first contact will be with our social worker, who will explain our services and our philosophy.
One of my biggest roles that I appreciate is that I get to be their advocate. I get to stand up for them, be their voice in a meeting. I get to be their voice to the doctor. They have value too, and I get to speak up for that and say, no, we're going to treat you more than what your disease is and the choices that you've made. You know what I mean? So I believe in it wholeheartedly.
When a patient is ready, we'll move quickly and address their physical needs, psychological needs, spiritual needs, emotional needs. It's basic human caring.
This organization, it's like these people care tremendously. It's like I work with people here who are scary smart, and they care so deeply.
It's not just that people came in to do things, but they actually cared. They actually were concerned and willing to help and do things that needed to be done.
We provide a team of specialists devoted to patients and their families. Your team will include your primary care physician, social worker advisors, counselors, chaplaincy, access to registered nurse support 24 hours a day, 7 days a week, and many other specialists. Most people don't realize everyone has a right to hospice. Generally, 100% of the costs are covered by Medicare and most insurance plans.
So hospice is covered by almost every insurance. Most Americans receive Medicare as a benefit, and Medicare Part A covers hospice 100%. Also Medi-Cal, for people who qualify for Medi-Cal, that is also a covered benefit. And then some other people also have private insurances as well that would be usually more than happy to pay for hospice 100%. There's normally no out-of-pocket ever for a hospice patient.
We will explain the qualifications for hospice care and coordinate with your physician.
So it's a new science. It's not programmed towards the cure of the disease. It's more towards the end stage disease, how to take care of the last part of the disease, where we are not looking at rehabilitation or cure, but to make the end life very comfortable and dignified, and so that it's not spent in the hospitals and having IV lines running left and right. We want the patient to be in their own environment, home or nursing home or assisted living, and get the best care.
Ask, would I recommend this team to my best friend or my family? And that answer would be absolutely in a heartbeat.
It will start with a phone call or email contact through our website. We encourage you to ask questions. Our people can talk you through it, what you're going through, and offer advice on what to expect the next steps will be. You are not alone. We at Advanced Home Health and Hospice are the team of caring professionals to walk with you. You owe it to yourself and your loved one to let us provide the solutions you seek. When you're ready, call us or visit our website. We're here for you.